I'm really tired of this lockdown. I do not want to really follow this lockdown. It is really killing me. I'm really getting tired of this lockdown. I want when it is going to open. The good news, tomorrow it is going to open. So let's be carefree. Let's enjoy the life. Let's get back to the social life. What to care? This lockdown is simply boring. Once again, we'll be back. We'll have an active nightlife. We'll really enjoy. We'll really go to the field. We'll play and we'll do all the things which you have been missing. If you're also thinking like him, then you are very wrong. And for that, you must watch this video today to understand that what could be the impact of not respecting the lockdown and being very carefree. So keep watching this video. But before that, I would request you to subscribe and like my channel if you really want to get some information and some important message. When the world is going to be out of lockdown, if you are also worried about the same question, then you must watch this video, because today I'm going to tell you that what exactly is the reason that why we are not able to leave the lockdown in most of the countries across the world. In India, tomorrow the lockdown is going to be out and people are going to come before, and this is considered to be as a partial lockdown or lockdown 5. But what exactly is the major reason that in spite of lockdown, still people are struggling to control the infection of COVID-19? It has been seen that since the time WHO has declared emergency or world epidemic after 30th of March, everywhere all government has been prudent enough in declaring the emergency or the crisis situation. And it is believed that COVID-19 has made one of the deepest impact in the world economy so far. But what exactly is the reason that in spite of so much of efforts by the government, by the organizations across the world, people are still not able to control this disease? To understand this thing, we have to understand that what exactly is the science behind the spreading of this disease. If you see, like any other contagious disease like common flu, or it could be the rotavirus, it could be any other virus like SARS. So if you go to the nature of this virus, it generally infects people slowly, and sometimes this infection is very faster because means the rate of transmission of pathogens is faster. However, it has been seen that in case of this particular virus, if we go by the kind of nature of coronavirus, it has been rapidly flowing so far and people are getting infected exponentially. So what exactly is lockdown doing and how helpful is the lockdown? Because it has been seen that people are really thinking that after lockdown we are going to be safe. But is it really the truth? Are we really going to be safe after the lockdown? Or this lockdown is going to extend further? So there are many such questions in your mind. I'll basically answer to all your questions in this video, and to get answers to this, please keep watching this video till the end. And before that, I request please subscribe my channel to get information about such interesting and important topics. I'm Pramakur. I'm basically an international speaker and a business coach, and I felt it's very really relevant at this point to give information about coronavirus. So as a social responsibility, I feel that I should basically try to educate people about the way how exactly this pandemic is occurring and how we can really come out of this. So if you really understand, this coronavirus is basically infected from a person to person. But however, we are trying to ensure that we are going to maintain physical distance, we are going to use the protective measures so that we does not transfer the pathogen. But it has been seen in reality that even after the lockdown, the graph is growing up. But what exactly is the reason why it is exponentially growing? In a country like India, which is really going to end its lockdown 4 tomorrow, that is 1st June, so we will see that we are going to face a new challenge, because it is believed that once the lockdown is over, the rate of infection is going to be high. So why exactly the government is not confident in controlling the corona? What exactly are the limitations? So we will try to understand. The first thing we need to understand that in all the developed countries, wherever the coronavirus has already affected, we have seen that the rate of death was very high. But fortunately, the rate of death is very less in India. The reason is that if you compare with the number of infected cases and the population, in India is having larger population than those countries. And the second thing is that if you see that the rate of testing is also not so much like those developed countries. But on the other hand, the good thing is that we have been able to delay the death rate. Lockdown is never a solution to completely give you a conclusive solution where this COVID will be totally eradicated, but we can delay the death rate. But parallelly, it is also important that how sooner we can get the vaccine through which we can immunize people. So if you go as per the BCG or Boston Consulting Group study, government is claiming that 1.2 to 2 lakhs people has been saved by doing the lockdown. In fact, I really appreciate the prudent decision of the government of India for doing the lockdown. In fact, he has been wise enough in doing this decision. Because of his foresight, many people's life has been saved. But is it enough? Let us understand that why exactly lockdown has failed in most of the countries. It is not only a question of India, but if you see that majorly in those countries wherever we have done the lockdown, still the number of cases has increased. Because if you see currently in India, the number of infected cases are 1,80,000 approximate, and the number of deaths till today is 5,000 plus. So why exactly we are not able to control the disease in spite we have the lockdown? The first reason is, if you see that we have however maintained a lockdown, but there is a poor coordination of the central and the state government. However, the government has made a lot of welfare policies, but in spite of that, those policies or reforms has not really gone to the grassroots level. So most of the time it has happened that there is always a miscommunication, and due to that, many people have suffered. For example, recently if I take the case of the migration labours, it has been seen that 90% of these labours are basically being challenged by the economic reasons. They are not even paid by their past employers, and however they are compelled to get into this situation, and when they are trying to come out of this economic challenge, they are basically being not given proper support. There is no proper healthcare infrastructure, there is no such proper rehabilitation program, and as a result what we find that a lot of infected cases are gradually increasing with the return of this migration labours. So what exactly the government should do? Government however has claimed so many things, but so far a direct help has not really reached out for some reason to these people. For some reason we can still see that these laborers who are really coming back to the city, they are not having proper quarantine facilities. Not only that, they are not even having the proper facilities so that they can return back to their places. So there is no proper screening facilities even. So in the very first place, we should have the process how we can identify these people, how we can screen those susceptible cases, and how we can isolate those infected patients instead of just allowing them directly to go back to their home. So these things probably during this phase of lockdown 4 we could have done, which could have further controlled the death rate or probably the rate of infection. If you go as per the Sears study or ACIRS study, it is basically understood that this particular ACIRS model is explaining this fact in detail. What does ACIRS stands for? It is basically known as susceptible, exposed, infectious, recovered, susceptible. So that is actually the model which defines this fact of infection in a better way. So if you see, it has been seen like any other infectious virus, this also is basically identified in two ways. The one who are basically susceptible in nature, and then one who are infectious in nature. So gradually, when a person is identified in the susceptible stage, he or she is basically in the verge of getting infected. So how we isolate them and how exactly we control the stage from the stage when they're susceptible to the exposed stage they are going. So if we can control that exposure, we can really stop to convert them into infectious stages, because these are just the compartments in which we have to confine this disease. And if you see, this is the real reason why we have not been able to contain the disease successfully so far. Because if you are not really identifying them, if you are not trying to contain them in a particular compartment, we will end up getting infected, and which can become fatal. So in this case, we have also seen the similar thing happening when people are basically having no such symptoms of COVID, but still they are positive. We have not taken enough measure in quarantining them and further controlling this patient. So if you really want to see the basic reason why this COVID will further spread when the lockdown will be over, because lockdown is, if you truly ask me, it is not an actual solution. But in a country when people have really very different thoughts, it is not easy to control the people but just giving the declaration, because even after awareness we can still see that people are still not respecting the protocols or the safety measures. So what we can do is we can definitely call a lockdown. But what exactly can happen after the lockdown? After lockdown we might see that people will come out in public, people will go in different places, because it has been already said in India from 8 June onwards, so many places like shopping malls, restaurants, and maybe other places like religious places will be open. So people will still start finding their opportunity to go out in these places. But in this crowd, if we have the R factor, Yes, you heard it right, the R factor. The R factor is considered to be responsible to control the infection. Now, what is this R factor? R factor is basically considered as the reproduction rate of this corona infection. So it has been seen that if the R factor is something which is below than 0, then we can control the rate of further infection. But if the R factor is beyond 1 or 1.5, then it means that if there are 100 infected patients, that 100 infected patients can further infect another 150 and then further 225, and progressively it will go on. So the basic challenge is how we can control the R factor, and for that we need a proper screening method, we need to have a proper healthcare measure. But before all this discussion, the government in all the different areas and states must ensure that are we in a position to suppress this infection? Are we have taken enough measure to strengthen the immunity of the common people? If we have really not done so, so it is too early to raise the lockdown. However, this statement is my personal and it can be different for many others. But lockdown has definitely impacted the economy of a country, because if you see, due to the lockdown, we have been compelled to open probably the liquor shop or maybe some other areas of income, and that is why people are getting more and more infected. But it might also happen that if we are really conscious and selectively using this area, we can still save ourselves till the time we have a proper vaccine to save ourselves. So my friends, we need to understand that during this stage of crisis, more common sense is required for us to take a decision. So we should not get carried away by emotions that lockdown is over, and we should simply get off guarded by all the safety measures. In this time, we have to understand those doctors, those healthcare workers who are really taking risk in helping the mankind, and they are trying to save the life. We should respect those government officials, those police officers who are really trying to tackle this particular pandemic. But in fact, if we really do not respect them, if we really do not follow our role and responsibility after lockdown 4 in India, we will be in problem. So it is a common appeal to all my friends and viewers who are watching this video, please be responsible enough towards yourself. It is the safety and your common sense which is going to save you after lockdown 4. If you really do not follow that, then nobody can save you. So please be careful and be responsible enough in acting after lockdown 4. Be safe, be positive. Thank you, my friends.